Good evening, everyone, and Happy New Year. It's good to see everybody. I'm Tasha Harper-Madison, proud City Council representative for District 1 in East and Northeast Austin. It is my great honor to be here once again for a brand new year of Talk with Tasha. It's my regular live stream that comes to you each week with new faces and important conversations on issues and topics that matter to you most. We originally launched the production to help highlight vital information about the COVID-19 pandemic. And even after a hiatus at the end of the summer, that pandemic is still with us. And unfortunately, it's gotten worse here in Austin and Travis County. Yesterday, we set an all-time high for cases reported in a single day with 1,108 new people coming down with COVID-19 in just 24 hours. The spread is out of control. Our hospitals continue to fill up. To help ease the pressure, the city this week opened up a temporary field hospital inside our downtown convention center. We're still in stage 5, our highest stage of alert. We're asking people to severely restrict their behavior, to stay home as much as possible, to wear masks whenever you go out. But after nearly a year of disruption, fatigue is clearly setting in and people are lowering their guards. The arrival of vaccines in Austin may have given some sense of hope that the end is near. Unfortunately, our local supply is still severely limited. Per state guidelines, the vaccines are only being made available to frontline workers, seniors, and people with chronic health conditions. The vaccine rollout, well, it's been a little rocky. Demand far outstrips our supply, and even worse, there are signs that the federal and state distribution strategies did not take into imperative equity concerns. Last week, I joined with several other Black elected officials in Travis County to raise our deep concerns about the rollout. And the Austin Latino Coalition joined us in demanding an equitable vaccine strategy. The Black, brown, and marginalized communities hit hardest by the pandemic cannot and must not be denied access to the one and only doorway leading away from it. So tonight we have a two-parter to talk about these issues. First up, we'll hear from the director of our Austin Public Health, Stephanie Hayden. She'll give us the lay of the land and let us know exactly how dire the situation is. And later, the big man himself, Travis County Commissioner Jeff Travillion, will join me to talk about vaccination strategy and what we can do to make sure that no one is left behind. This is more than just a bunch of talking heads rapping to each other. I want you to be a part of the conversation too. Drop any questions that you have in the comments section, and we'll do our level best to answer those on this broadcast. And don't forget, the city provides a wealth of COVID-related resources on its website. That's www.austintexas.gov/COVID-19. So let's get down to it. My first guest is one of the hardest working people in City Hall. She's had her hands full in the past 9 months and has played a crucial role in keeping the wheels on the bus. Director of Austin Public Health, welcome Stephanie Hayden.
Thank you for the opportunity to be here this evening.
Absolutely, Director Hayden. Thank you for joining us. I can only imagine how busy you are, so we really appreciate you taking some time out to offer us a little bit of in the way of clarity. You know, when you first came on, you had your jacket on and you said you'd been out at the Delco Center watching the operation firsthand. I also had an opportunity to see it firsthand for myself. So we'll just dive right on in. From your perch as the Director of Austin Public Health, what would you say is the state of Austin Public Health and this pandemic right now?
Well, we are at a point where we are at an all-time high. Our positivity rate is 16.5%. We have 1,000 cases yesterday were positive, and a day or so before that, it was 900 cases.
Wow.
So we are our positivity rate, all of the cases coming in, and it is such a serious thing. Our hospitals have definitely the rates have increased in them as well, But another area that we're definitely really concerned about is now we are starting to see more positivity in school age children. At the high school level, 20% of our young people um, are testing positive. Middle school is 27%, and elementary school is 19%, and our preschool is 10%. And I know for some folks this really makes us concerned, and we are concerned. But we know that the transmission is tied to extracurriculum, is tied to carpools, and it is also tied to sleepovers, etc. And I know that young people like to spend time with their friends, etc. But what is happening is that they are transmitting COVID from to each other. And so it is so important for us that we are very careful, and we're doing everything we can to keep our young people safe. But we also have to keep teachers safe as well. The data we're seeing now is a result of what happened over the New Year kind of celebration time period. All of any celebrations, any get-togethers, any parties, etc. That is what we are seeing right now in our community. We had been a community where we didn't have 15% of our beds were available to our community. Well, we have exceeded that. And so because we're at this really urgent point of time, we are just asking everyone to really only make essential trips from your home, continue to wear your mask, continue to wash your hands, stay home if you're not feeling well. And we still have our testing sites available for folks to be able to take their tests. And so that just kind of gives you a snapshot of what's going on in Austin and Travis County.
Thank you very much for that, Director Hayden. And one of the things that I actually ran across today was an article that talked about grocery trips. You put some emphasis on essential trips. I'm just curious, is that one of those trips where, you're encouraging people to do curbside and do delivery if they're able to? Are we, I know in that we had that chart about the level of risk. Have we increased in some level of risk in those grocery store runs?
Yes, our hope is if you're able to do that, please do that. If you're not able to do that, if you can, designate the person that's going to go to the store. Okay. Don't take the entire family to the store. Sometimes it's an outing. We got to get out this house. Okay, we're going to the store. Everybody's going. And so we don't want you to bring your entire family to the store and decide who that one person is going to be, and that's the person who makes the trips to the stores, and that helps quite a bit. The other thing is try to maybe avoid peak times in the store. Let's just really think about it. There's always been peak times in the stores, but knowing that if you're able to get up a little earlier and get to the store a little earlier. The other thing I encourage folks to do is definitely use a list. That way you're not kind of going through the rows and you're thinking and you're pondering, exactly what you want. You go in there, you go through the line, go through your list, and you're in and you're out. Right. So those are some really good tips.
Well, thank you. I appreciate that. And it certainly won't be any surprise to you when the bulk of my questions and the bulk of the questions from our audience are about the vaccine and how do we get it? Where do you go to get it? Who's eligible? How do you get signed up? Folks who are asking questions about the registration process. I know that there was a little bit of a glitch in the process. We talked about this a little bit before we went live, but everybody from the city working remotely still is kind of bogged down that system, which subsequently is bugging out this system. And so folks have questions. So one of the questions that I'm going to take now is people want to know whether or not you can get the vaccine if you do not have health insurance.
Oh, absolutely. We really, the Austin Public Health is a safety net provider. Our preference is we want to be able to provide the vaccine to people that don't have a health insurance and don't have a medical home. And so definitely we want you to go into our system. We want you to enroll in our system. The other thing that I will just tell you is that this is a little different than a doctor's office making an appointment. You know, with a doctor's office, you call and you schedule, and they'll schedule you for a couple of months, and you have the appointment. Well, that physician is not going anywhere, unless something happens and they resign and go somewhere else. But even with that, they can bring another physician in to see you. This is not the case with the vaccine. We are not allowing folks to schedule appointments until we have the vaccine. Once we have the vaccine, and we're not saying the vaccine is on the way to us, we want to actually have it in our possession.
Mm-hmm.
We want to have the vaccine, and then from there, we want to be able to schedule the appointment. So the appointment is tied to us having a vaccine that we can give you.
So that's one of those tangible things that we can refer people to, right? They are understandably frustrated, concerned, scared, confused. I think that's the case for a lot of us, myself included. And I'm at the policymaking level. So about those, much needed vaccines, how many do we have? And frankly, haven't heard so many officials say we just don't have enough, yourself included. How many do we have? Why don't we have more? And when can we expect more?
Well, we received 12,000 vaccines on Monday of this week, and so we have stood up our clinics and had our operations. We have used 7,000 of those thus far, and so we booked appointments for tomorrow and the next day. That way we will be finished with the 12,000. We yesterday received an additional 12,000. And so we will continue to schedule appointments next week. So folks will be able to go into the system and schedule appointments for next week so they can use the vaccines that we have with the 12,000.
So from the original 12,000, we had 5,000 left over, and then we just received, praise God, an additional 12,000. So we have 17,000 total as of today, this Friday.
Well, it's more like 16,000. Yeah, okay. We have 4,000 left out of the 12,000.
Okay.
And that was at the beginning of today. So by the end of this day, I will not have 4,000 left. It'll probably be closer to probably 2,000, 1,500, somewhere along in there is what I'll have. But the additional 1,200 came on yesterday afternoon. So now what our folks, have checked it in, and so now we're going to schedule appointments for next week,
mm-hmm.
and start, working our way through that 12,000 as well.
So I know we've talked about this already, and I mean the austintexas.gov/COVID-19-vaccines. That's austintexas.gov/COVID-19-vaccines. I know you all are talking about this at length, but just to repeat, who, in terms of preferential treatment, we're talking about people that are 65. Let's start with the 1As. The 1As are our first line workers, correct? First responders, people who work in medical facilities, nursing homes, etc.
Yes, your healthcare providers, because you want to make sure you are protecting the healthcare infrastructure and long-term care. Yes.
Thank you. And then the expansion of that, those are the 1B folks. And so those considerations include being 65 or older or having an underlying health condition, a pre-approved underlying health condition. And, it's safe to say that those conditions include any condition that compromises your immune system, correct?
Yes.
Thank you. Yes. I appreciate that. I think we have some more questions, Caleb. I don't know if you're popping them in and I just can't see them, but I have a couple on my end. Okay, so the next question is it the Moderna, and whether or not you have a choice between which vaccination you receive? Thank you, Erica, for the question.
Okay, yes. So Erica, right now, Austin Public Health has been receiving Moderna. Typically, there are only 2 vaccines that are available. Pfizer has been going to the hospital healthcare type of settings and systems. Moderna has been coming to the health department. And so if you're coming to the health department, you sign up and you get in next week, you will be receiving a vaccine from public health, and it will be Moderna. They're in the process of there's a couple of more that are in the pipeline for approval, but right now, Moderna is what the health department will continue to receive, until further notice. The state controls what they control what comes to us. We don't have a choice of, I want Pfizer, I want Moderna. And so they will send, each provider what they want to send us.
Thank you. I appreciate that clarification. One of the other questions that we had earlier in the day, there was a person who had expressed that they are immunocompromised and had some concerns about waiting in line with, such a large amount of people. This person had concerns about mobility also. So, when I visited the Delco Center, I saw an abundance of wheelchairs. It looked like a lot of folks had brought their own, and these look like, correct me if I'm wrong, these look like city provided. They were all exactly the same. The wheelchairs, it looked like city provided wheelchairs for people with mobility concerns. But then I also saw a lot of people bringing their own lawn chairs. So this person who had expressed their concern was worried about 2 things. And if we could answer their question, that would be great. What happens with folks who are concerned about the amount of people? Is there any way around that? And their mobility concerns? What, other than, like I said, those wheelchairs that I saw and people bringing chairs, what considerations do we have under those circumstances? I know for a lot of folks, they're assuming because I made an appointment at the time that my appointment is, I should be able to walk in, walk out, be done. So they have concerns about waiting. Can you talk to us a little bit about logistics?
Yes. Every operational period, we really look at the kind of the flow of traffic and how we can, get folks in and out of the facility. If you have any mobility issues, we have designed a special area where we're taking people through that are wheelchairs and walkers that have any type of mobility challenges, and so we're moving them through pretty quickly. Now, what I would suggest with the, if you're immunocompromised, I think one of the things that would probably be helpful is that we're really asking people to keep your kind of 6 feet distance, and we're working on that pretty quickly. I will tell you, I was kind of looking at the flow today, and it just kind of depends on kind of the time of day. But folks were getting through there pretty quickly today. In and out of the stations is, it's relatively, that part of it is maybe about 10 minutes. Depends on how long the line is, but the line is moving pretty quickly to move us through. We have several stations that are there, but the distance is going to be, definitely important, and definitely having on your mask, etc. And we're just really trying to get people through as quickly as possible.
I appreciate that, Director Hayden. Just to point out a couple of things before we wrap and move over to Commissioner Travillion, some things that have been pointed out to me throughout the course of the week. One, that doctor's office have been telling people to show up unannounced, no appointment at the Delco Center. That is, in fact, not the process, and you will not be seen if you show up at the Delco Center with no appointment. That's one of the things I wanted to make certain that people understood. The other thing that I'm understanding based on just some of the news that I've seen in the last 12 hours or so is that it appears as though private clinicians, the ARCs, are not receiving more vaccines. Can you offer us just a tiny bit of clarity there quickly?
Yeah, that is the state's decision. Even when, conversations here about Austin Public Health receiving vaccine, the goal with the state is the state will allocate that vaccine. And so my hope is, we don't know how much vaccine the state of Texas has. And so my hope is that they are going to start to provide the private healthcare clinics, et cetera, the vaccine. That way, Austin Public Health has vaccine that we're using, and then they have vaccines for their clients as well. Unfortunately, I was there today, and we had to turn some people away and let them know, that we were not going to be able to see them. And so, we took their information, et cetera, gave them a flyer and said, make sure you register, and all of those things where we're really trying to be more helpful. But we're definitely not allowing people to come in to get a vaccine if you do not have an appointment.
And I appreciate that. We have to respect the process, if for no other reason. There are reasons that we have, priority populations. But it's also very understandable that people are frustrated and that they want to, they're looking at the same numbers we are in terms of increases. They just want to get, have the vaccine and be able to be healthy and well and get back to, some sense of normalcy as soon as possible. And we, none of us can blame them for that. The one last question that I'll ask while I have you is, we received more than a dozen, or rather more than a dozen local school districts sent Austin Public Health a letter asking to prioritize educators in our vaccine strategy. Before we bring on Commissioner Travillion, what would be your response to that request?
Well, we have developed a process. We are standing up a clinic on Monday. We've sent out a survey. Now, unfortunately, it has to be 1B, folks. We cannot go beyond 1B. And we communicated that to public schools, private schools, and charter schools. And so we're just getting them to respond to our survey. And so we'll be able to start, on Monday, and then, be able to do 500 on that day. And then from there, kind of based upon, when more surveys come in. But we are definitely working through a prioritization process with them. And we're going to start Monday, since that's a holiday for them, be able to get at least 500 of them done on Monday.
Thank you. I appreciate that clarification. And we'll probably have you on again soon. Like I said in my opening remarks, we didn't have any idea that when we took that hiatus that we'd still be here in mid-January. So thank you for your time. We really appreciate it. And we look forward to talking to you more soon. Thank you, Director Hayden.
Thank you.
All right, folks. So like I said to Director Hayden, I anticipate that we'll have to have her back on and some of our other medical professionals and public health authorities, because there's just still so much moving. It's a moving target. And so we really need to just be able to bring you the most up-to-date information possible. If you haven't done so yet, we'll throw it up before we take off. But if you haven't done so yet, subscribe to our newsletter. It is a really comprehensive resource for information about COVID-19 and COVID-19 vaccinations right now. But that austintexas.gov, COVID-19-vaccines, that's the place to go to get most of your questions answered. And if there's anything beyond that, never hesitate to utilize your council members as a resource. So we've talked about vaccines and how to make sure that we have equitable distribution. Earlier this week, I joined the other Black elected officials in Central Texas to raise our concerns about what we've seen so far. That included the mayor of Manor, Dr. Larry Wallace, State Representative Cheryl Cole, Pflugerville City Council member Rudy Mateer, and last but certainly not least, Travis County Commissioner Jeff Travillion.
Good evening. How are you?
Hi there. Doing well. Thank you, Commissioner. We appreciate you joining us. We have the great pleasure and the honor of having the Commissioner join us right now to talk about the statement we issued, why we issued it, and what the path forward looks like. And I know that y'all have more questions. If they are specific to the conversation that Commissioner Travillion and I are having, then feel free to leave them. If they're not, and we don't get them answered during the course of the segment, we're going to encourage folks to keep sending those questions in anyway, and we'll do our best to get them answered. So, Commissioner Travillion, I'll just jump right in with you too. When did you first notice that there was an imbalance in how these vaccines were being rolled out, and what the sort of best practices were being called for the national strategy, and what was your immediate reaction?
Well, I think that you could argue that from the very beginning, the federal government has not built the type of plan that is necessary for the needs of the entire community. And basically what happens is you get to see all of these structural inequities across the community. And they are exacerbated in this type of scenario. What we heard from Washington was, well, within a few weeks, this was going to disappear. I think that the state followed the federal government too closely. I think that we started with a deficit from the very beginning. We have found ourselves being in the worst performing 3 states consistently. So I think all of those issues have been difficult. We've not had good leadership from the federal government, and I'm afraid the state government was feeding too much into the federal government. But the issues that we have are structural issues that we have seen since 1928. When you look at the number of places that could receive the vaccines, 65 of them are in West Austin, only 9 of them are in East Austin. We don't have a consistent set of HEBs or CVSs or Walmarts in the old East Austin areas. So what we have to do is hold up more public facilities, whether they're co-located schools or community centers with clinics, or schools that have clinics placed in them. The difficulty that we have to work through is our structural inequities that we have seen for generations. And it is unfortunate when we have an event like this, which is something that has not occurred in multi-generations. You get to see all of the warts and all of the problems. And that has been what we have seen from day one.
Yeah. And, I think we all have said time and time again, these issues didn't just arise in, February, March, when we were really being cognizant of just how impactful this virus would be in our communities. These are decades long problems and inequities in our communities that are just being highlighted by this virus. So, I think you touched on it a little bit already, but as big and diverse as Travis County is, there's a lot of communities on the western side of I-35 that seem to have more gravity when it comes to access to vital things like vaccines. Just generally, what's your personal strategy for working with people from Lakeway or Westlake or even just West Austin to make sure that East Austin, Manor, Weberville, that we get our just share of the opportunity?
Frankly, my strategy has been to work within the northeastern corridor and the southeastern corridor to do 3 things. Number one, to point out that there are inequities that are structural and that we have to work through them. Number 2, to meet periodically with school officials with city leaders, and then with community leaders, because what we know is where there is no formal network, low-income communities and minority communities have always had to band together to survive. So when you think about what we did when schools closed down initially, the first thing we did was we sat down with our school board members to talk about how we make sure kids continue to be fed. You know, how do we make sure that we don't allow food to rot in freezers, but we actually take it, cook it, and get it to families who are in need of it. So we started off working with our school officials. We included our city council members as well. We worked with our city and county apparatus to make sure that we were empowering the nonprofit groups and the restaurants that would be preparing and delivering food to families. I think that the very same strategy is going to be necessary as we lay out vaccines as well. It is going to be our public spaces. You know, every school, every community does not have an HEB, but every community does have a neighborhood school. We have to go through that same apparatus, working with those same community leaders and those same elected officials to make sure that everybody understands the information that is available, they understand the resources that are available, and that we're able to take advantage of those opportunities when they show themselves. You know, part of the problem that we have had is a very small number of vaccinations compared to the large number of people who need them. So, you know, what we've been trying to do first is make sure that our A1 community is taken care of. We've been working to make sure that our 1B community is taken care of. But we also talked today when I viewed the Delco Center, we talked about how we could find other public spaces that would allow us to provide more access to people, easier access when the vaccines become available. It seems to me that the Biden administration is beginning to discuss how many large centers they will open up within the first month of their involvement. We have not had a coordinated plan from the federal government that has been large enough to address the need that we have in this community. We still have way too few vaccines available, and a desperate need for folks who live all across the county and not just west.
All of that, right? And so, you know, one of the things that that we were bringing attention to when we released that press release was, you know, we have fire stations, we have firefighters who are trained and can administer vaccines. You know, some of the other assets in our communities, in addition to schools, in addition to fire stations, are our places of worship, you know, and they have shown up and said, hey, you know, the Lord's house is open to you for whatever it is that you need it for. And I know that there are people who have been shooting us ideas, and I just want to make sure to take this opportunity, you know, like you just laid out what we did for the meal strategy. And, you know, to take that even a step further, we had similar strategies around caregiver meals. So we were making sure not only were our scholars eating, but their parents, their guardians, their siblings also were eating. I think sometimes if we don't, you know, really highlight the effort necessarily, folks don't know that we're working double time behind the scenes to try to tap into any and all available opportunities. So we certainly are doing that, which brings to mind for me, this is one of those times where when we're asking the community to be patient, we're asking the community to be safe, to take care of one another, to take the necessary precautions around safety. A lot of what we're asking them to do, Commissioner Travillion, is to trust us, right? In which case,
Absolutely.
that's come about, you know, that question about whether or not people can trust the vaccine. There's clearly, you know, I don't know if you have had the opportunity yet to see that line wrapped around the Delco Center 3 times yet, but there's clearly enough people who are willing to put that trust in our medical professionals and in the system. But for the folks who aren't quite certain whether or not they trust it. I think I've been reframing the question often, or reframing my presentation of what I believe is the appropriate response, in that the folks who don't trust the process, who don't trust the medication, I don't know that they're entirely wrong to be skeptical. So we lead first by acknowledging, the validity of their concerns. And then what would you say after you acknowledge the validity of their concerns?
Well, I think a healthy dose of skepticism is probably very appropriate. I think that we have seen generation after generation, where things were not done by one set of rules. You had one set of rules for one group, another set of rules for another group. I think that we were able to build trust, or we have been able to build some trust over time, just by doing what we said we were going to do. When CARES funding became available for us, we put $10 million into making sure that small businesses were able to keep their doors open. We put $10 million into making sure that we were able to deal with social service needs. We put a couple of $1 million into making sure that food was available. I think that you earn the trust of people by demonstrating to them that you have done what you said you were going to do. I think it is clear. It is important to make it clear where the problems are in the process, what we have to do to address those problems. I applaud the efforts of 33 mayors and county judges who have said that the vaccine ought to be given out just like the CARES funding was given out. If you have a jurisdiction of over 500,000 people, maybe those resources should go directly to those county and city governments rather than going through the state, when it seems that the state has not demonstrated the type of equity that is necessary to make sure that we take care of all of the people's business. It is going to be critical that we make sure that we do our jobs, but that we make sure that when something is not done properly and in order, we call it out.
Absolutely. And I think that's a really good segue into my next question, because that's that opportunity for them to follow our lead. What would you say we can do as leaders and members of the community? Frankly, I think oftentimes we overlook the value of the leadership of members of our community, people who advocate for their neighborhoods, their neighbors, their friends and family every day. What can we do? And, the folks watching right now, to help build the community's, resilience, to help, put people in the community in a position to make sure that they are as educated as possible. So, for example, one of the questions that we had on in our comments was, if you are not a teacher, how do you get the vaccine? Somebody else asked, my mom is 62 years old with no health insurance, no doctor. How do they get the vaccine? So it's like, all this information seems, quote unquote, readily available because it's on the website and there've been the PSAs and a couple of town halls, but we clearly still need to be doing a better job driving home the information, delivering the information, giving people clear, concise information about where resources are. Do you have ideas about how we could just generally do a better job of communicating with our constituents and our communities?
I think that we have to continue to do what we've learned to do over the last year. We understand that we are in a terrible place as it relates to being in level 5, as it relates to the number of cases increasing every day, the number of deaths increasing every day. So it's going to be important that we reach out to people through not through face to face, which is what I prefer, but actually through electronic mediums. It is going to be important that, I always love to visit different churches, visit different neighborhood associations, go to places where people actually are. go to ball games and things of that nature. Those things are not available to us, but we can participate in Zoom calls. We can participate in phone calls. It's going to be important that we provide information, that we send emails to each other, that we make sure that everybody has access to information about what is going on in their neighborhood and when it's going on. It is clear that we have to change our behavior. It is, all of us by now know somebody who has been directly impacted by the virus, whether we've lost them or whether we have seen people severely suffer because of it. And we've got to recognize that we are not going to be out of the woods probably through the latter part of the summer. And, we're going to have to take precautions to make sure that we keep each other safe. We're going to have to take precautions to make sure that that as we go out, that we are masking ourselves properly, that we're distancing ourselves properly, that we're washing our hands, and that we take advantage of the various resources that are available now. Months ago, I never heard about anybody having their groceries shipped to their home, having some of their basic necessities shipped to their home. We must take advantage of all of those things, and we must continue to talk to each other and look after each other and use our community networks to make sure that people are being well taken care of.
Absolutely. And, that's one of those things you got me thinking about in terms of distributing information or disseminating information, rather. You can get your groceries delivered for between $6 and $9, or I'm sorry, $6.95. So between $7 and $10. It's between $6.95 and $9.95. You can get your groceries delivered. And just thinking through, especially for people with transportation issues, just how that opens up so many doors for folks. But also, let's recognize, for some folks, $7, $8, $9, $10 is too much, too many dollars. And so I wonder if that's a conversation we need to be having as the city and as the county and adjacent municipalities. How do we make certain that if we're encouraging people to get their groceries delivered, how do we make sure they have that $6, $7, $8, $9, $10 to get those groceries delivered? Because something I think a lot of folks don't recognize yet is you can use your SNAP benefits with the HEB to go groceries. So you can use your benefits to get the groceries you need. And if you don't have the option of the curbside pickup, which for folks who aren't familiar, you arrive at the grocery, you park in one of those spots that says curbside. You text the folks inside the store to let them know that you're there to pick up your order. And, they text you back, let you know they're on their way out. You sit in your car for between 5 and 10 minutes. You pop your trunk, they come, put your groceries in. Completely contactless grocery in your car. And then there's the other option where they come directly to your door and they leave those groceries, also contactless grocery delivery to your door. So I think that's, another question we should be asking ourselves in terms of access and equity. It's interesting for some folks, $9.95 would never be a barrier to anything.
Right.
Right.
And the other thing that we have seen is we have really seen churches step up and work with communities. We saw Greater Mount Zion and we saw St. James both make themselves available as places where the Central Texas Food Bank could drop food off. We saw African American churches partnering with Latinx churches, partnering with white churches to make sure that they were directly working with people. We saw Operation Turkey feed more than 8,000 families. We see one investment that Travis County has made. We just put another $1 million back into the food outreach process. We've been working through Joy Chevalier and her team, working through Black women in business, working through any number of nonprofits, and then some for-profits. Hoover Alexander's. Hoover's has been working with us. A number of businesses have been working to cook food and take it directly to people. But churches have been looking at their sick and shut-in list. And some churches, like Alpha Seventh Day Adventist Church, has put a food bank together at their church. We have seen groups step up, but we have got to make sure that these resources are sustainable, so that when we have organizations or businesses that find pockets of people that need to be served, that we continue to make resources available to serve them. I've seen so much wonderful work happen just because community members decided that they want to help someone. I've seen a COVID-19 task force in Manor. I've seen a coalition work together in Del Valley. A lot of work has been done by Constable Morales in that area. We have seen communities step up. We have to make sure that they continue to have the resources to serve the community.
Absolutely. And, you got me thinking about another group of folks. There have been several within the course of the last week. There have been several fraternal organizations that are having their founders days, so I know that the Deltas and the AKAs, are having their founders days. And a lot of these, sororities and fraternities were founded on the concept of public service. And so I just wonder, this is one of those all hands on deck opportunities. I just wonder how quickly we can mobilize everybody that has that sort of, building power to bring people together and really just show up for our communities. As it has been made plain, we can't rely exclusively on our public health authority, especially when they are at the mercy of the state and they are at the mercy of our national rollout. In fact, I'll expand on that a little bit. A lot of folks don't know exactly how it played out, but the national strategy for vaccine distribution was grocery and pharmacy. We entered into this arrangement with CVS on the national level from the distribution strategy perspective, not recognizing just how many communities would not be effectively served, how many communities that would absolutely leave out. And so now as we're looking at this more, regional, and then, getting more granular into communities and just recognizing what resources, what assets do we have within communities. I hope that these are the kinds of conversations that continue to happen. I absolutely understand, people's frustration and concerns about, the system getting gunked up and there being bugs with, really just trying to figure out that scheduling part. But I'd say this is definitely the time for everybody to be pitching in a way that's productive and helpful and actually gets our communities the things that they need. So, we're pushing about 5 minutes away from being able to wrap for the night. Commissioner Travillion, I always enjoy having the opportunity to speak to you. I really appreciate that. One of the things you consistently bring to the table is your decades of service to our communities, your decades of service to the East Side community, frankly. And I just want to make sure that we give you the room and the space that you might need to impart any closing statements on us.
Well, I think you just said I was old, but it's okay.
I said you have been blessed with the opportunity to grow wise and experienced. Aren't you fortunate?
Well, this is true, and I'll say this. A lot of us are fortunate enough to have memories of our parents and our grandparents, and we have seen difficulty and struggle before. I remember both of my mother's parents were farmers, and they basically raised everything that they ate. And this is a time when we have been getting back to basics. Our community has never had all of the things that it deserved. But because we took care of each other, because we paid attention to each other, we knew each other, whether we worked with each other, whether we went to church with each other, or whether our kids just played together. This is the time for us to go back to all of those lessons that we learned, that established us, that built us as a great community. Reverend Joseph Lowry used to say it like this. He said, all of those things, babysitting each other's kids, driving into work with each other, growing a garden, all of those things were fresh water. And this fresh water is what got us to the mainstream. But now that we've gotten so sophisticated when we've gotten to the mainstream, we've forgotten about all of those things that got us there in the first place. So what we've got to do is get back to basics, look after the neighbors that we have in our area, make sure that the relationships that we have in our community we sustain and we nurture. And we have to do those things until the cavalry comes. The cavalry always comes to our neighborhood last, but we can take care of each other, and we know we can because we've always had to. So I just encourage you to continue to do what we've always done, continue to look after our friends and relatives and neighbors, and make sure that we put our community first, and that we give ourselves an opportunity to make sure we're working until those vaccines get into our neighborhood. And we'll do the best that we can to make sure that all of our community members will have access. It is important that we have access, and it's going to take a while for us to get everybody with shots, but we've got to get that done, and hopefully it'll happen sooner rather than later.
You're absolutely right. And I certainly don't want to ask for too much of your time in 2021. I know I leaned on you pretty heavy in 2020, but it would be great if we could call on you to come back and talk to us a little more about what's going on in the county and what we're doing moving forward. I really appreciate that we're taking this opportunity to, like you said, get back to the basics. Let's take care of one another. Let's get back to, I haven't prepared this many meals in my home. Folks ask often about, the silver lining. I haven't cooked at home this much in years. I haven't had grocery bills that frankly are so small because I'm able to do larger batch cooking. And so those are kind of some of the things that I think as a community, we should be talking to one another about, just because there's a lot of folks that really are hurting out here. And I think, even for those of us who are so fortunate that we're not really struggling, that we ought to, batten down the hatches a little bit so that we are able to be a little more generous with our giving, with our tithing, with our, contributions to our neighbors. I rest in peace to him, but we lost another brother in our community, and our condolences go out to the Craney family today. Billy Ray Craney passed away from COVID-19, and their family, they're trying to do what they can to make sure that they can offer him the dignity and the respect at his end of days, and having the appropriate service that their family seeks to have for him. So all of those things involve all of us. And so I really appreciate that you brought that up. I really appreciate that we're doing this, in terms of a movement. We're doing it adjacent to, along with our brown brothers and sisters. I know that history, if you allow it, it says a lot of things about how we treat one another in Black, brown communities and, marginalized communities. But I just want to make certain to highlight that when it's time to, we step up and we take care of one another. And I see us doing that. And if we have to take away anything from such a challenging situation, that definitely is one of the things that I am inspired by, and that, as we're thinking about Dr. King today and in the coming days, that's something that he reminded us to always keep in our hearts, is that hope. And so personally, I am hopeful, and I really appreciate you coming to share with us, and we look forward to talking to you again some more soon.
Love to talk to you anytime. Thank you for the invitation. I look forward to working with you. There's so much for us to do.
Thank you, Commissioner. We appreciate you. Have a good weekend.
You do the same.
All right, folks. So that's about time for us. We really appreciate you joining us. I hope it was helpful. And for what it's worth, we are always open to constructive criticism, always open to more questions. Express your concerns. This cannot be about folks just talking at you. We want to talk to you and with you to make certain that we're doing what you tasked us to do. It is our great honor to be able to advocate for you at every level. And so make sure that you keep us honest and hold us accountable for being able to do that job well. And we don't know whether or not we're doing it if you don't tell us what you need. So please never hesitate to reach out. We appreciate you joining us this evening. Again, we appreciate Director Hayden with Austin Public Health and Commissioner Travillion with Travis County for joining us. I think we covered as much as we could in a short amount of time, but the truth of the matter is we have so much to cover. So as we run out of time on this week's edition of Talk with Tasha, the one takeaway I have for tonight is, please let it be this. We are at one of the most decisive points ever in this pandemic. The virus is spreading like wildfire, and it's our regional healthcare capacity that's feeling the stress. I can't stress that enough. The city is preparing to open up our convention center. I'll say that again. The city is preparing to open up our convention center as early as next week to serve as an emergency field hospital in the city of Austin, our capital city of the great state of Texas. And as we've said before, all of this sickness and death is falling disproportionately harder on marginalized communities, Black people, brown people, people who are on the lowest rungs of the economic ladder. This is a giant test of who we are as a city and as a region. If we truly take seriously those progressive values that we wear on our sleeves, we will do what it takes to stop the surge and to bend the curve back down. When we say things like stay home or wear a mask, yes, that is for your safety, but it's also for the safety of your parents, your grandparents, and your neighbors. Perfect strangers, frankly, who might be more vulnerable to this deadly and dangerous virus than you are. Staying home, wearing a mask, those are acts of compassion. And I am begging all of you to be compassionate and to urge others to be compassionate. We are truly all in this together, and we will only make it through this together. So until next week, stay safe, stay healthy, and where you're able, as always, try to have some fun. Thanks for joining us, everybody. Have a good night and a good weekend.